can a lumbar disc herniation be reabsorbed naturally by the body? That's what we're going to cover today. Really important topic, because lumbar discs, and if they protrude or actually prolapse, can cause some debilitating symptoms, and symptoms that commonly are referred for surgery. Probably the most common spinal surgery that happens from an orthopedic nature is lumbar disc-based surgery. So let's cover whether the body can absorb naturally some of that disc material if it squeezes out into the wrong spot. First of all, let's have a little quick revision of the anatomy. When you look at a vertebra, that's the back of the vertebra, but when you look at it from the top, you can see here the disc. That disc is roughly the same shape as the actual vertebra. That's how a disc should be, and that's a healthy situation. When a lumbar disc bulges or protrudes or prolapses, then it doesn't look like that. It looks more like that, where you can see the red material, which is usually in the internal inner section of a disc, like jam inside the middle of a donut, starts to find a way through the outer sections of the fibers of the disc, and actually in the worst scenarios can poke its way all the way through and start to get into the space, as you can see in this example, gets into the space where the nerves are, the spinal cord and the nerves. In those scenarios, it's really common to be debilitated. It's common to have a lot of problems, particularly in your leg, starting often in the buttock, moving into the upper leg, down into the lower leg, into the foot. We can have significant pain, searing pain, like a red hot poker, like a pulling pain, through to weakness, numbness, tingling. It can be so severe that people can be bedridden and cannot live their life as they have known their life to be. So it's a significant issue. And what we're going to cover is whether, if it gets to a situation like this, what are the alternatives to surgery in terms of, can the body do something about this naturally? The human body is amazing. It's an amazing structure that is constantly chopping and changing the way that it's operating depending on the circumstances we're in. And in this case, what can be done naturally by the body? Let's get into the meat and potatoes of this discussion right now. Interestingly, the type of herniation really matters. So sequestration or extrusion, which means that the disc material squeezes out so far that it gets right outside the disc shape and into where the nerve elements are. Those type of herniations, whilst often the most serious and the most pain-inflicting, well, they're also the ones that interestingly lead the body to send a lot of macrophages to that area and neovascularization. Now, this is just a fancy term for the body setting up a strong inflammatory response into that area. Macrophages, they are a type of cell that are literally like Pac-Man in the body and go around and through their inflammatory process help to absorb material like Pac-Man. So what they're actually doing is they are in there along with neovascularization, which is meaning new blood cell formation. They are helping the body to actually deal with that sequestration or that extrusion of material through reabsorbing it naturally into the body. So the type of herniation really, really matters. However, not all lumbar disc herniations are likely to be reabsorbed. The type of herniations which lead to modic changes, which are bone-like changes that you can see on MRI, they are less likely to resolve naturally. The type of herniations where the disc material is thicker, the disc cartilage is thicker, they are less likely to be naturally able to be absorbed. So it does depend on the area to some degree, and it does depend on the type of disc herniation. Now, moving forward, how this can be used is through modern technology and through having MRIs, a practitioner should be able to see the type of disc herniation you have and how severe it is, and get an understanding or an idea as to whether the likelihood that your body can naturally resorb the material is there or whether it's highly unlikely. And certainly if you have some confidence that, or the practitioner has confidence that the material can be absorbed naturally, then it's recommended that you undergo some conservative treatment, some adjunctive type treatment to help the body, which is naturally already doing a great job of absorbing that material. You may be seeing some practitioners which can also assist with that, but you go down that avenue rather than the avenue of feeling like you're stuck in a corner with no way out and surgery seems to be the only option. So summarizing it all back, the interesting thing here is that the most serious disc prolapse or extrusion are the ones that tend to lead the inflammatory response to go to the area. The inflammatory response is behind the reabsorption. So really, in a way, the positive in having a serious disc prolapse is it's more likely the body can naturally absorb that. As with all things, the information I'm passing you here is of a general nature. You should definitely check in with your trusted team of health advisors if you are currently going through something like this, because every case is different, every human is unique and different. But the information is really important to understand. There often is hope, and there often is more hope, particularly in the darkest of days where you feel like you are suffering and struggling the most. So remain optimistic. Seek the assistance of people with knowledge if you're unsure, and hopefully you find a way through this and a way to recover if you are dealing with a situation like this with the minimum amount of invasion necessary. Wherever you are, I hope you've enjoyed the content and that it's been of use to you. And if you have any questions or want any more information, please reach out via the comments and I will endeavour to get back to you.